alaikum wa rahmatullah. Thank you, Mr. Chairman, for the nice introduction. And I'd like to thank the scientific committee for inviting me to try to answer this question of whether microalbuminuria is a risk during the month of Ramadan. And to start or to try to answer this question, I think I'll go back to the concept or the background why this talk has been chosen. And when the group that has put the risk calculator for diabetes in Ramadan, there was a much debate on whether microalbuminuria should be considered as an independent risk factor for fasting during Ramadan or not. And the group that has suggested putting microalbuminuria as an independent risk factor separately, their idea was that microalbuminuria is known to predict macro and macrovascular complications in diabetes, and it is an early sign of diabetic nephropathy. So, and they based that on studies that said, like this study by Adler that looked at patients with macroalbuminuria and elevated creatinine and found that patients with microalbuminuria has double the annual cardiovascular risk. The other group that has suggested not to put microalbuminuria as an independent risk factor, they said there are no studies that suggest that microalbuminuria without renal impairment is an independent risk factor for hypos or hyperglycemic events. So no data were available, so they said not to put it as an independent risk factor. So I tried, thank you. So I tried to answer this question, and what I did is I looked into the literature and I searched for microalbuminuria and Ramadan. I used different keywords to try to find an answer, but all what I get is there are no evidence. I didn't get a single paper. So I thought there is a mistake. So I went back to the librarian in the university and I asked them, can you help me with the search? And we found nothing. Only a single paper, and I'm going to show it to you later. So I thought I'll try to put hypotheses and try to find a link between microalbuminuria and fasting during Ramadan. And my first hypothesis were to try to answer these two questions. And the first question is, would Ramadan fast impact albuminuria and progression to kidney disease? And the correlation that came to my mind is fluid intake during Ramadan would impact microalbuminuria and kidney function. And I found a paper that looked at the enhanced survey that looked at the association between fluid intake and renal dysfunction. That included microalbuminuria and as well chronic kidney disease. And in this analysis, what they found that people who take more than 1.5 liters per day, they have less risk of progression to kidney disease and less risk of development of microalbuminuria. Then I thought, can I apply this to Ramadan? Because during Ramadan, we have a specific period of time where we don't take, there is no fluid intake. But it doesn't usually apply to Ramadan because in Ramadan, the study has basically evaluated long-term fluid intake, and in Ramadan, it's only 14 or 16 hours, and then you start drinking enough fluid after that. So that doesn't apply to Ramadan. Then again, during my search, I tried to find anything that says Ramadan fasting, an improvement in albuminuria, and what I found, a single paper where they reported a case, and this is basically what I found, improved albuminuria. It's a case that has been reported with a patient with abnormal, higher glycemic control. They modified their medications and they started them on sulfonylurea, and they found an improvement in glycemic control. Even the authors did not suggest that is related to Ramadan. They said this is probably related to improvement in glycemic control because of the medication and the impact of medications on microalbuminuria. So to answer the first question, whether Ramadan fasting impacts microalbumin excretion, there are no data at all, and we cannot conclude whether Ramadan fast impacts albumin excretion or not. So if I try to look at the other question, which is microalbuminuria per se a predictor of hypos and hyper during Ramadan? There were no any published data yet, but I looked at the DAR survey 2022. And in this survey, there were around, the first examination, we looked at 16,390 patients, and out of those, 518 cases were found to have microalbuminuria. Of those 518, around 459, which is around 88.4%, were patients with type 2 diabetes, and the rest were type 1 diabetes. Now, we thought we need to compare those patients, but we need to exclude the confounding factors that are already there in the risk calculator. So we looked at patients with microalbuminuria, and we compared them to patients with without microalbuminuria, but they don't have chronic kidney disease, they don't have cardiovascular disease or macrovascular complications. Those with microalbuminuria, we looked at only at patients with normal kidney function. So in all of them, eGFR is above 60. So to remove the chronic kidney disease as a confounding factor here. And we try to analyze and compare the two groups. So if you look at the baseline characteristics in the two groups and look specifically at the age, people with microalbuminuria were significantly higher, older than people without microalbuminuria. Again, they had a higher duration of diabetes, 13 years compared to 8 years in those without microalbuminuria. They had higher A1C compared to those without microalbuminuria. The BMI wasn't quite different between both groups, but even if you look at medications, they are on higher risk medications like insulin. Again, most of them, or higher number of them, were on SGLT2 inhibitors compared to those without microalbuminuria, which explains the presence of microalbuminuria is an indication for these medications. Now, if we look at comorbidities, people in the microalbuminuria group had higher comorbidities like hyperlipidemia, retinopathy, even macrovascular complications, and foot ulcers were more in the microalbuminuria group. So when we tried to analyze the duration of fasting in the two groups, people with microalbuminuria actually had less days fasted compared to those without microalbuminuria. And when we look at the number or duration of days fasted, again, they were less in the albuminuria group. And however, those with microalbuminuria had more intentions to fast in the month of Shawwal compared to those without microalbuminuria. More important data are there on the hypoglycemia. If you compare the people with microalbuminuria to those without microalbuminuria, more patients with microalbuminuria developed hypoglycemia. And that was statistically significant. If we look at those people who developed hypoglycemia, only the cohort of hypoglycemia, the days they had hypoglycemia were more in the microalbuminuria group. Those who broke their fast because of hypoglycemia were more, around 77% compared to 54%. Those who attended ER are also more in the microalbuminuria group, almost 5 times the number of those without microalbuminuria. And even those admitted to hospital were quite significantly higher than those without microalbuminuria. If we look at the hyperglycemia, more in the microalbuminuria group, almost 23.9% compared to 13% developed hyperglycemia. But the data in hyperglycemia is a bit more different. We had more patients in the microalbuminuria group broke their fast because of hyperglycemia. However, those who attended emergency because of hyperglycemia were more in the non-albuminuria group. And those admitted to hospital were more in the non-albuminuria group. However, duration of stay in the hospital was higher in the microalbuminuria group. So what are the limitations to this study? The first and most important limitation is that we did not quantify the microalbuminuria. We just put patients as they had or they don't have microalbuminuria. And that would have allowed us in the future to find a cutoff beyond which we say, well, beyond this microalbuminuria might be a risk, and below that it's fine to fast. Regression analysis, we didn't do regression analysis for confounding factors for a simple, and that is going to be done later. However, when we tried to look at patients with microalbuminuria without kidney disease and no micro or macrovascular complications, the number of patients was quite small to allow conclusions to be made. The A1C, again, if you look, there were significant differences at baseline between patients with microalbuminuria and those without microalbuminuria with regard to age, duration of diabetes, and comorbidities. Another limitation is that we didn't have enough data on the RAS blockers, which might impact the microalbuminuria. But the main strength is that this is the only study yet we have about microalbuminuria as a risk in patients during the month of Ramadan, and the sample size is a good sample size. So if I would like to conclude again the second part, I would say that we are having now some sort of preliminary data that suggests that subjects with microalbuminuria with normal kidney function have an increased risk of hypos and hyperglycemic events during the month of Ramadan. However, the impact of confounding factors need to be evaluated. We need further studies, controlled trials that adjust for confounding factors and quantify microalbuminuria to assess its impact on Ramadan fasting, and that these upcoming studies should have different groups. The first group would be patients without microalbuminuria, without risk factors. The second group is a group with microalbuminuria with normal kidney function and no complications. And the third group is those with microalbuminuria and micro and macrovascular complications to be able to draw conclusions. With this, I will end my presentation, and thank you very much.
Yeah, thank you.